Heads Up Health webinar series. I'm TJ Anderson, excited to briefly kick us off here. You're tuning in to Bridging the Gap between Research and Applications in Metabolic Health. This is our April webinar series to end the month, and we've got quite the partners joining us and quite the topics for you today. We'll allow everyone to introduce themselves, but as I mentioned earlier, we'd love to hear from you as well. If you want to introduce yourself in the chat box, please let us know where you're tuning in from. Tell us about your interests. If you run your own practice, let us know about the type of work you're doing. So I'll go ahead and move on to the next slide, and we can have everyone start introducing themselves. John, you want to kick us off?
Yeah, I wasn't sure. So I'm John Lemansky. I'm the Chief Medical Officer at Heads Up Health. I'm an active user of Heads Up Health, and I'm a practicing clinician. I focus on preventative health. So the topic today is right up my alley. I'm excited to hear what some of the new research is coming out and speak with our panelists.
And I'm Dave Korsunski, founder at Heads Up. Grateful to have Jim from Biosense here and the MHS team. We've been huge supporters of the MHS work and have enjoyed our attendance at past events and hopefully in the very near future, future events. So we're just really honored to have Victoria and Dr. Poff and Jim here. This is a very prominent topic for me personally, as well for my own health, and also a lot of the work we do at Heads Up, facilitating remote monitoring around metabolic health. So welcome everyone. Thank you for joining. Jim, is Jim on?
I just promoted him to panelist. So
all right. Look back around to Jim.
Hey there, can you hear me okay?
Yes, sir.
All right, thanks for having me. I'm Jim Howard, CEO of Readout Health in St. Louis. We're a digital biomarker company that uses breath technology, essentially crack the code on using breath to monitor and biosense analytes in the breath. So we have a device called Biosense, coincidentally, same name, and it's used in metabolic treatment protocols that we'll talk about today, specifically for breath acetone or ketones in the breath. So we've worked with everybody in this call to some degree. We have a biomarker that's tracked and used within Heads Up Health for their clinics that are using protocols such as that. So thanks for having me.
Hi, I'm Angela Poff. Oh, sorry, we jumped in at the same time, Victoria. My name is Angela Poff. I'm a research scientist at University of South Florida in Tampa. I work primarily on non-toxic metabolic targeted therapies for cancer and neurological diseases. Our lab focuses a lot on ketogenic-based therapies, but we do other work, including things with hyperbaric oxygen therapy and other metabolism-based pharmaceutical approaches. I'm also a co-founder of Metabolic Health Initiative, which is the organization that hosts the annual Metabolic Health Summit, which is a scientific and medical conference dedicated to bringing together the latest and greatest research and clinical applications on ketogenic and other metabolic therapies. And that's something that we usually host every year. Of course, this past year, or actually, I think this weekend was supposed to be our MHS 2021, but we unfortunately won't be there this weekend, and we have delayed till next year in 2022, but we're still coming back.
Bigger than ever.
Yes.
Exactly. And I'm Victoria Field, co-founder of Metabolic Health Initiative alongside Angela. Angela and our history kind of goes back. I used to be involved with a nonprofit involved in cancer research in humans and canines, and we got connected and said, you know, we really need to bring all of the incredible people in the scientific and medical communities together so we can further the research on metabolic health and metabolic-based therapies. And that's sort of where Metabolic Health Summit came to be. But our organization is really focused on not only sort of educating the public through our once-a-year event, but also through digital educational content as well online. So we are just excited to be here and working alongside our partners, Biosense and Heads Up. It's been an exciting journey so far. And we're really, really excited about where the future is headed with, especially with metabolic health and metabolic-based therapies. So excited to be here.
Thank you, team MHS and Jim. Appreciate you guys being a part of this and being such great partners. So I'll go ahead and we've already done the introductions. I'll go ahead and pass the ball now to our Chief Medical Officer, Dr. John Lemansky, to go ahead and kick things off for today's panel.
Sounds great. Thanks, TJ. Thank you to everybody who's here with us today. If you have any questions, feel free to write them in the chat box, or at the end, we're going to try to do a Q&A if we have time. So let's maybe start off with Victoria. We've talked about metabolic health, but can you describe to us kind of a definition of our current understanding of what metabolic health is, and then how it applies in a clinical setting?
Yeah, it's really interesting. Our traditional sort of view of metabolic health is sort of the definition is the absence of disease, right? So we kind of use metabolic syndrome as sort of a way to kind of define metabolic health, but that's kind of starting to really expand. But traditionally, you're looking at sort of 5 markers when you're looking at something like metabolic syndrome. You're looking at waist circumference, fasting blood sugar, triglycerides, HDL levels, blood pressure. And depending on those markers, if you have 3 or more that are sort of out of where we want them to be, you're looking at something like metabolic syndrome. But I think that definition is really starting to sort of expand. I think as patients become more empowered through tracking and collaborative efforts with their physician, you're really starting to see people want a little bit more than just trying to avoid metabolic syndrome. Let's take it up a notch and start to really optimize our metabolic health. And what does that sort of look like? So you're seeing that also expand as metabolic dysregulation. What's interesting is, especially in running a scientific conference on metabolic-based therapies, you're kind of really seeing this common theme throughout a variety of diseases. Metabolism is literally involved in every aspect of what we do, who we are as human beings. It provides us the ability to thrive. And you're seeing this metabolic dysregulation going on throughout a variety of diseases and sort of linking them all together. And so it's exciting to see kind of where this is headed. It's sort of this common kind of inflammatory thread that is showing up in other ways beyond just obesity, beyond just diabetes. These are obviously things that we're very familiar with when it comes to thinking about metabolic health, but you're seeing it in areas like cognition, cognitive issues, gut dysbiosis, PCOS, sleep disturbances. There's a variety of areas that it's really opening up to. And we're seeing, it's not a one size fits all approach, as tracking has really allowed us to start to see. And we're kind of watching this really interesting shift. Actually, when we first started our scientific conference, it was really like this meeting of the minds that wasn't really open to the public, but it became very evident early on that patients and just the general population were really wanting to understand, okay, how do I take this information, this science, and apply it to my own life potentially? So I think that's where sort of the tracking world was kind of born, and it's taken off from there. And it's really, I think you're seeing a lot of patients that are continuing to propel this movement forward and push the research in a really exciting direction alongside their clinicians. I think more than ever, you're seeing a really collaborative effort here, which is exciting.
Yeah, no, that's a great point. And I think, so metabolic syndrome, by the time you've gotten to the point where you're in metabolic syndrome, I mean, you've really been in some sort of metabolic disarray for 10 to 15 years probably. And so, part of our goal with Heads Up and with Metabolic Health Initiative, and I know with Jim and Biosense, is to how do you capture that period of time before you get to that point, before you have, diabetes that's out of control, or hypertension that's out of control, or cancer, or certain things that are really being driven by this metabolic dysfunction is what I tend to call it. So I think we're at a great time period where we have some research that actually now backs up kind of the claims that we're making. We have the data points that we can actually use to track our ability to improve people's health. So it's an exciting time. I want to bring in Jim because I know there's a lot of research these days going into different metabolic pathways. But I know you guys are involved in research studies. So maybe you can kind of expand on some things that Biosense and Readout are working on in terms of utilizing breath ketones to help people with their metabolic health.
Yeah, a lot of these people we met at the Metabolic Health Summit, actually. So I think it all comes together.
Yeah.
But, you know, when we formed as a company to provide frictionless and frequent testing, you know, as close to a CGM as you can for ketones at a clinical grade, we work pretty focused on metabolic disorders. And what's really happened in the past, if you look at the past year and a half, 2 years, there's been such a large number of studies going on globally that we're part of that are metabolic treatments or just standard nutritional interventions for chronic diseases outside of metabolic disorders. So, I mean, we are being pulled into ophthalmic, obviously neurocognitive decline, mental health, brain injury. And these are, you know, government funded types of studies, as well as, you know, as typical academic research and even pharma. We got a pretty big pharma trial this fall. So I think that, and I'm not really sure if it's just the fact that nutritional interventions are gaining such steam because of the failure of other treatment protocols, or it's because biomarkers are needed and, you know, for the in-home clinic model of the clinical case. But whatever it is, there's been a pretty big uptick in adoption of having clinical grade breath or other types of frequent, you know, ways to track biomarkers, and you just have to have that. And it probably helps too that, you know, CGM, you know, I mean, CGM is now available to consumers and therefore available, you know, in so many other, you know, types of trials. And we just kind of fit on the other side of that metabolic switch. So some of these studies are pretty interesting and very surprising too.
Yeah, absolutely. And you know, with us at Heads Up Health, and maybe Dave, you can expand on this, you know, we've been working on the back end to really facilitate studies to show, you know, correlations between different protocols and how that benefits people from a metric, you know, actually measuring data points. So Dave, can you maybe expand a little bit more on some of the technologies you think that really pertain to metabolic health and some that we've seen used in Heads Up?
Man, there's so many these days, and they're all part of the same interconnected system inside the body. But just starting at the top, I think Jim touched on it: continuous glucose monitors, and those becoming accessible to more people. And I think that is a huge leap for individual health because it is also personalized. Kind of like Victoria said, an individual's blood sugar response to a certain food or event is going to be determined by many factors: the composition of their gut microbiome, their age, their genetics, their body composition. There's lots of things. So the CGM allows people to see this in real time. And I think that is absolutely a game changer. I hope the cost and the accessibility of those devices continues to come down. I think, you know, that's number one. And then the ability with a device like Jim's to then overlay that and see on that same graph, as you're looking at these real-time data points of your blood sugar, when do you start dropping into a ketogenic state, or with an extended fast. So people are starting to learn how to calibrate these things on their own. I know for me personally, sometimes eating the same meal just under different circumstances causes a different blood sugar response. This exact same thing. Mm-hmm. So for people to start dialing this in, it's not that hard. You just eat the thing and watch the dots, basically. and then you can start doing things like optimizing the quality of your sleep with some of the technology out there. Like, you know, there's a number of them out there, or being a very common example, but getting a better night's sleep. And that has positive implications on your ability to self-regulate, make better food choices, and also have better glycemic control. So there's the CGMs, there's the ability to measure going into a ketogenic state. There's the devices for sleep, devices for activity, also devices for heart rate variability. That's another biomarker that was previously obscure and clinical, And now like everyone knows their HRV. And everyone's starting to see like, wow, okay, if my glycemic control was super tight on this day, my HRV is higher the next day. And these are like incredible correlations that people are starting to make on their own. And then when you have a talented practitioner on the other end that can help you with interpretation and optimization, I think maybe going out on a limb here, but I'd say the individual now has better tools than the doctors do in some cases, honestly, because they have so much of this real-time biofeedback. And then the doctor on the other end can help with the interpretation, the medical interpretation. But the technology for the consumers now is getting better and better and better.
Yeah, absolutely. I think we're in the prime time in terms of being able to really get people healthy. You know, we have the research that's coming out or that's out. We have the data points, and then we have the clinicians who, the ones who understand, can actually use that biofeedback to make changes and show, you know, not just from weight loss, but also here are all the metrics we're looking at: high sensitivity CRP, you know, fasting insulin, all the metrics you measured and mentioned, and really kind of facilitate, you know, a cohesive plan between a practitioner and a patient. I think it's a great time to be. I want to bring Angela in because we haven't heard from her yet in terms of this, but we talked a little bit about, you know, research, but beyond just kind of weight loss and metabolic health, I know your focus is really on research in terms of cancer and hyperbaric. Can you maybe talk a little bit about some prominent and emerging kind of research in those fields and how the metabolic health perspective actually applies there?
Absolutely. Yeah. So, and Victoria mentioned this at the beginning. This is what's been so fascinating being a researcher in this field over the past decade, seeing that, 10 years ago, people were interested in metabolic-based therapies in very kind of niche areas. But now it's being applied for very good reasons, really across the board. So my main focus is in cancer, and it goes beyond this kind of association that was really highlighted a few years back, where we see that, an individual with type 2 diabetes, for example, or obesity, very kind of classic metabolic dysfunction hallmarks, do have an increased risk of developing many types of cancer. But then you look even at a tissue level, and you begin to see the molecular underpinnings of these diseases also having these characteristic metabolic abnormalities in terms of inflammation, oxidative stress, mitochondrial damage. The mitochondria are really the hub for all of these cellular processes that are going on, and are probably what's kind of linking all of these disparate disorders together through these common threads. And, so we do a lot of work looking at cancer. For example, ketogenic therapy, which ketogenic diet or even exogenous ketones is something that we've really studied in cancer. Across cancer model systems, there seems to be a consistent anti-tumor effect in animal models. And this is not across the board. There are certainly model systems where that's not been reported, but it's something that's moving into clinical trials now. And they say there's probably about 25 human clinical trials ongoing right now that are starting to really parse out, okay, what we're seeing in the animals, is that going to also apply to humans, which is critical. And then very interestingly, I would say neurological conditions is the other really major area where metabolic therapies are becoming extremely prominent. And again, because you see these consistent abnormalities, you have neuroinflammation, you have energetic crises that occur at the tissue level in neurological insults, be it from an organic kind of initiation, like something like a dementia or Alzheimer's, or even epilepsy or autism. You see these kind of stereotypical abnormalities in the metabolism that are present and potentially, susceptible to metabolic targeting. Even though they seem completely unrelated to something like obesity or metabolic health in general, they are extremely well linked. And just for a really cool example, within the past year, there's been at least 3 or 4 reports that came out, largely in preclinical models, though, looking at ketogenic therapies to preserve neuronal survival after, for example, spinal cord injury or peripheral nerve crush injury. So again, these are things that 10 years ago you wouldn't necessarily have thought would be amenable to some kind of lifestyle intervention, but they are. So we're really excited about where this is going, and people are excited about potentially having a tool to intervene in their own health, and then also track it, with these devices and these apps that are so useful for someone to take to their clinician when they're on these journeys.
Mm-hmm.
Yeah, no, that's a great point. As a clinician, having taken care of people on the other side with Alzheimer's, dementia, ataxia, and those are devastating, or, cancers, devastating to treat and for family members. Some of the research that's come out there, and especially in Europe, I know there's a lot of research going on with ketogenic diet plus hyperbaric oxygen therapy plus stem cells and things like that. It's fascinating, and I think it's really kind of the precipice in terms of our understanding of those specific diseases. So kind of moving on from that, although we could spend days, I think, talking about each individual question that I'm asking.
Yeah.
Victoria, I wanted to ask you, in this age where there's so much information on the internet, and you can have a camp that says, this is the way to do it, another camp tells you the exact opposite. What are you guys trying to accomplish in terms of the Metabolic Health Initiative, in terms of allowing patients and consumers and practitioners to come together and consume the data or the information through you guys?
Yeah, that's a great question. For us, it's all about leading where the science is taking us, really. The conference used to be called the Conference on Nutritional Ketosis and Metabolic Therapeutics, a little bit of a mouthful there, but it expanded into Metabolic Health Summit because, while a large part of our conference focuses on ketogenic metabolic therapies, we also want to be inclusive of a variety of topics and potential when it comes to the science. So let us sort of lead us in the right direction. And let's call it Metabolic Health Summit because, it's becoming very evident that our metabolic health is tied to just about, everything when it comes to bodily function. So it's really sort of expanded kind of over time. And we really noticed, as I mentioned earlier, early on, that in order to push the science forward, in order to really support what's happening in the labs, in the clinics, we really have to be inclusive of the medical profession, but also the academics, but also the everyday person that really wants to get a better understanding. But it was very, very important to us to lead with that science straight out of the gate, to offer incentive as well through continuing education, and really become this platform where you can go to get the very bleeding edge science on this topic, and we're going to present it in a way that I think sets us apart from the rest. And so that's always been sort of at our core, to let the science lead the way when it comes to metabolic health research. And it's been very interesting to see how patients are very involved, and just everyday people, in sort of at least establishing that conversation maybe with their doctor, bringing up their markers, asking questions about other markers. Maybe they heard it at our conference and they, want to know about, I don't know, an NMR lipo profile. Now that's a conversation piece. And that's really important, I think, to open up that communication that maybe, wasn't there before because we're not also educating the public. But at the end of the day, for us, it comes down to scientific education is at our core. So.
Yeah, no, that's great. I mean, from a clinician standpoint, I can tell you in my experience, having the research to back up the claims that I make is paramount. So I know you and I have talked about this a little bit offline, that, as practicing, even, MDs, DOs, any healthcare professional needs to have the research behind them in terms of what they're saying, or else, their liability is very exposed. So the more research we get, the more research in terms of things like fasting, which I know Jim is involved in, really helps us to be able to promote that. I do a lot of biohacking, so I recommend fasting, sauna exposure, cold therapy, things like that. And it's hard to do that without actually having data to back it up. So on that note, Jim, can you maybe talk about, I know you're focusing on personalized fasting, and maybe that's a key kind of tenet in your clinical and consumer applications. Can you maybe expand a little bit on that and what you guys are trying to accomplish?
Yeah, in the past year, I guess, as we've seen the popularity in clinical protocols, especially, well, in the consumer segment too, of intermittent fasting as a protocol that's just being widely used. It's not just a ketogenic diet; it's whatever the protocol is that puts one into that state of ketosis and repair. We've seen that that's more of a dynamic ketone level, right? Whereas, someone that might be in the same carb restrictive dietary protocol is less dynamic, but it's only one direction in intermittent fasting. So the tools available just weren't available unless you're going to like prick your finger every few hours. And ultimately there was such a lack of education in fasting where, there's just a time element. You do your 18-6 because someone told you to, or you read that you're in autophagy, which is not true. Very few people can reach that in that short of a time. So we've kind of decided to do some studies on that. And we showed that it takes a lot longer, which I think any clinician would know that the impact of intermittent fasting, it takes a while. And also depending on what your metabolic base is or how flexible you are, it could take days to reach a certain state of cellular repair. So I think that what we wanted to do is we looked at tools that are out there and to track fasting, and we decided that you really need to have, like all these fasting wheels that everybody has, you need to have personalized fasting. You need to make that determination that if the goal is a health benefit, let's look at those level of ketones every few hours and see, what the impact is. And maybe you don't need to fast 72 hours. Maybe you need to only do it 40 hours to reach whatever that biologic state is. And if that's kind of an inferred autophagy, or if it's a mid-level of ketosis, whatever that is, we can show you. And that's it. So it's been a focus of the company for the last couple of months. We've got a pretty big release here in a couple of weeks on our own app to offer the first personalized fasting wheel, essentially. And then obviously that data can go into things like Heads Up Health if that's within the treatment protocol of that clinic. So we're pretty excited about that. We've invested heavily in that.
I'm excited for that to come out because I do a lot of fasting protocols on myself and my patients, and you're right. I mean, it's not a one size fits all. I mean, some people reach ketosis very quickly, some have a harder time, and depending on what you're trying to accomplish, it would be nice to have that kind of personalized data point. That was a good segue for Dave. If you don't mind kind of talking about, on that note, how do you feel individuals are using like technology like Heads Up, like Biosense, different tracking devices, like to self-manage more effectively, taking away just the clinician aspect, but the individual person, how are they really able to use that? What do you think is working? What's not working? And maybe expand a little bit on that.
Yeah, well, before I answer that, I just want to say Jim just dropped a golden nugget there. I'm excited for the fasting clock inside the Biosense app. That should be a fun one. But to answer your question, John, I mean, I started experimenting with metabolic control back in like 2015 when none of this stuff was on the radar. And everybody was a do-it-yourselfer back then. It was all being done in Facebook groups trying to figure this stuff out on our own. So I think by nature, once you go down this path as an individual, you are kind of a do-it-yourselfer, because you may not have access, depending on where you live or how your health insurance works, to a provider who wants to work with you in that way. And yet you're seeing success that other people are having. So I think by nature on this path, there's always an element of do it yourself. And that's what I had to do. That's why I needed a way to see all of this stuff holistically. So in terms of what's working, I think there's a huge community aspect to this that's happening online. And that's exciting. There's good support and information, and that body of knowledge continues to grow. So in terms of what's working, the technology is getting better, so people can get better feedback from their bodies. That's all it is biofeedback. And that technology just continues to improve. The support and the research is out there. I think that's continuing to improve through a lot of the work that's being done by organizations like MHI. So I think the accessibility is getting better, the technology is getting better. On the challenging side, in terms of what's not working, I'd say that for a lot of people, it could be finding a supportive provider on the other end. That's changing, but for a lot of people, that's still a challenge. I think that cost also could be another angle to consider. That the technology is not cheap. You can run your own labs here in the U.S., thankfully, but that's still out of pocket. And access to the food to even eat this way in certain parts of the world and the country, those are much larger macro issues. But I'd say those are things we still need to work on. We're seeing positive signs from within the, I guess you'd call it the conventional paradigm. A lot of the monitoring that individuals are doing, so monitoring at home, their blood sugar, for example, that is now starting to become something that conventional doctors can get paid to do remotely through remote patient monitoring for metabolic related conditions. That's a huge step forward. So individuals can do this self-monitoring, and the provider on the other end can now start to bill the provider system and get paid at par with what they'd get for an in-office visit for remotely monitoring these vital signs. This is all new and a massive step forward. I think that could open up access to more providers who can do this type of thing. So that's a huge leap forward. So yeah, technology improving, John, still challenges at the macro level, starting to see improvements in the way that providers can get on board with remote monitoring using this technology. Those are just some of the things that are top of mind.
Dave, can I ask a quick question on that? Are you guys seeing with your clinicians using Heads Up Health that you've got like two camps? One camp is, I want as much data as possible from all these different biomarkers to manage the patients. And then another camp that I don't really want all that because I don't have the time to look at it, but I sure as heck want my patients to have access to it and through cognitive behavioral therapy, make adjustments to their, their behavior. Are you guys seeing that? Or we're fascinated by that because there's just really two camps on that.
What we've seen work better, Jim, is less is more when it comes to these types of things. So when we're setting up a new clinic with a remote monitoring solution, we actually recommend taking away as much information as possible and starting with only the most important biometrics, because it just reduces the cognitive load for an individual. And if you have some patient, client, whomever, who's a biohacker and wants to really go deep, that's fine. But in general, we often recommend starting with fewer metrics and then starting to add more over time. That usually results in a better experience. We've got thousands of different biomarkers in our system we could expose, but we typically will customize and start with only the most important ones first.
Yeah, I would agree with that. And as a clinician, I started in 2003, so I got a lot of time on you, Dave.
You do, actually.
I went to a medical library because there was nothing online. I started with the ketogenic diet. That was the 4-to-1 ratio for seizures. It was the worst thing I ever experienced, but it worked with what I was trying to accomplish. So we've come a long way. But in terms of your question, Jim, initially I used every data point that I could find, and it became overwhelming. And the more people I was taking care of and treating, the more I realized that a lot of those variables overlap. And so if you're seeing a positive change in one metric, you're going to see it in another one. So I agree with Dave, at this point, I've streamlined it to a very select, and then depending on maybe what the goal is, some people it's weight loss, other people, maybe it's better sleep. There might be a little bit of addition in terms of the metrics that I'm following, but in general, I think less is more. And part of the biofeedback is, at this point, I don't have to look at my Oura Ring data in the morning or my Whoop data. I can tell you plus or minus 10% or 5% what my deep sleep score is or what my REM score. I know because I know how I feel. So, and I've noticed that a lot of people will get that feedback, and so they don't need as much data points. moving on to kind of that topic, Angela, with this, one last thing I wanted to say before that, sorry, is I think, the one positive thing out of this whole experience we had in 2020 is that before 2020, 0.5% of all medical visits were on telemedicine. After 2020, it's about 35%. So this kind of directional change to being comfortable with speaking to clinicians, practitioners online, I think is a huge boost for what we're all trying to accomplish, because now you have no limits to accessibility, basically. But having said that, how, and maybe Angela, you can address this, but how is the Metabolic Health Summit and MHI kind of evolved in order to really allow for providing, a platform of science education, especially in this period where maybe in-person, discussion is not available?
Yeah, we think that's critical. So, I mean, MHS really evolved out of a need for communication and collaboration between academics and clinicians that were working in different fields. So, we were noticing at that time, about 5 or 6 years ago, you would have scientists and clinicians, perhaps working on the same therapy in cancer, and then someone else working in the same therapy in some neurological disease, but we weren't learning from each other. We weren't necessarily going and reading the papers from these adjacent fields and taking that information to move the whole field forward faster. And it became so clear that to meet our common goals, we really had to start communicating. And so in this time when things have changed dramatically, over the past year, I don't think anyone kind of knew what was coming where that's concerned. It became even more clear how critically important this is. MHS is an incredible experience, and it's a live experience that we love that component of it, but it's not enough. We know that there's much more that needs to be done on a daily basis. And so that's something that MHS has really dedicated. We've dedicated ourselves to making sure that the most up-to-date information is going to be provided. And so we provide educational content year-round. And we actually are very excited. We have plans for the next year to kind of even increase that further with some cool things that we're going to be announcing within the next few months. But, for right now, just doubling down on our intent to make sure that we're constantly providing access to this information. And I appreciated the question you sent to Victoria earlier about how do we kind of approach this idea of putting the prioritizing what information we get out there. And as a scientist in this field, I've been very protective of the conversation because it is something that people are really interested in, and it's something that a lot of people are talking about, sometimes very responsibly, sometimes not so responsibly. Mm-hmm. And so that was part of the reason that I wanted to get more involved in the public conversation about this, because we want everything we do and put out there to be evidence-based before all. And so we cite everything we put out there. We vet every piece of information. It's very important to us. And so we've really, continued on that mission to make sure that we're providing the best information available, not just once a year, but really around the year.
Yeah, no, that's great. And in terms of, vetting the information, yeah, I kind of mentioned it earlier that, there's so much information. You'll see news articles that are, pretty definitive. This is what meat causes cancer. And then you look at the actual studies behind it and it's, garbage. And so I think it's a extremely important thing to not only have the research, but be able to have it in one place to really kind of drive, the information, not the narrative, because people are coming at it from different perspectives, but they want the actual real science. And, as a clinician, I can tell you, trying to research, a specific topic and trying to connect the dots, it's a lot easier to go to you guys and say, okay, the dots are connected for me. I don't have to do the extra work because a lot of research is very specific. It's looking at a very, very specific pathway. And how do you take that information and then actually apply it clinically or to maybe a different kind of process? It's extremely important. Victoria, did you want to add maybe anything to what Angela said in terms of, this online space, how you guys are really trying to create this pathway to get information, and maybe also how you use data. I know you had a personal experience. We talked that we weren't really going to talk about things that were too controversial, but I know you went through an experience with COVID and used your data to really kind of help you, guide you in terms of regaining your health.
Yeah, well, to back up what Angela said, I couldn't, I'll say it again, evidence-based information is what we do. And so, that if you go on our social media accounts, or if you go onto our website and check out the presentation videos, what you're going to get is backed by at least what we know so far in the research. Like, that's incredibly important to us. We even put together a year in review ebook. 2020 for many people, for all of us, really felt like, man, that was a rough year, but it also was a year of incredible progress in the science community, at least when it comes to ketogenic metabolic therapy. So we even put together this free resource that sort of provides you with a quick overview of what's happened, over the course of the year. And you can find that easily on our website. So we're very much dedicated to being that reputable source that you can go to if you're a clinician. You can get it all in one shot, right in one spot. So that's where we're continuing to sort of develop MHI, is to become more than just this once a year scientific conference, even though it provides amazing value in and of itself. And we're so sad we weren't able to gather this year. Just the networking and the collaboration that comes out of that event, from whether it be on the sort of entrepreneurial side, or even, the scientific collaborations that come out of that, or simply even clinicians being able to speak with patients firsthand and hearing vice versa. It's a really cool thing. But digital education content is our next sort of phase of where we want to go. But yeah, in regards to my personal experience, data tracking I've much like you, I've always been into tracking my own health for as long as I can remember. And before, was on a ketogenic diet, before ketogenic diet was, it was used in epilepsy, but that's about it. And, was exploring it myself and tracking all the things. But it's really become even more important to me in recent years, because I unfortunately was diagnosed with COVID over Thanksgiving and got hit pretty hard. Whether you want to call it long COVID, I don't know. I don't do labels, but I'm still dealing with the effects today. But what's interesting is, I have an Oura ring, I have a Biosense meter, I track just about everything you can track. And I really started to see a lot of my health markers sort of deteriorate, especially even after COVID. And what's interesting is it's progressed. I got diagnosed over Thanksgiving, but then it started to develop even further around January. And it's been a strange experience, but things like HRV, Dave, like what you were bringing up, has been very interesting for me. I've seen a significant decrease in that. I've seen, my resting heart rate, that's changed and increased. I've seen ketone production kind of shift. I did get HIPAA consent prior to this, and my husband has seen an increase in blood glucose levels, fasted blood glucose, since having COVID. He had it as well. And so we've seen sort of, sleep quality, all of these markers, which really opened up an interesting conversation for me to have with the cardiologist, the pulmonologist, the people that I'm seeing, to say, hey, maybe, should we look into this a little bit further? Maybe it doesn't mean anything, maybe it does, but what else can we do? And I think that is a really, while it's been a really challenging time, health-wise, it's also been a really interesting time from the sort of side of me that loves to sort of geek out on tracking devices, because I've seen such, I've been so focused on where I was previously with, a slew of blood work, always, focused on sleep, gut microbiome, all the things. And see that shift quite dramatically for me really was quite eye-opening. And so, yeah, I just think it can open up a sort of the floodgates to interesting conversations with your healthcare team, that maybe you're able to explore avenues that might not have been explored previously because you have a set of data points that you didn't have if you didn't have an Oura ring or whatever. So that's been a very interesting process for me.
Yeah, it's an unfortunate end of one experiment.
Right. The experiment I never wanted to do, but
exactly.
It's interesting. Yeah.
Now you have it. But and the important thing too is that you have your previous baseline,
Right.
and
Yes.
then you have your new baseline.
Yes.
And then hopefully you can get back to that new and improved baseline, and you can see, because it's very hard and it's very frustrating, I think, for both the clinician and the patient to say, how do you feel? And the response is, I feel like crap. Well, that's a very, very, subjective metric. I mean, I feel like crap every day, even though my Oura, readiness score is perfect. But like, how do you quantify that? And I think that's where the data really comes into play, in terms of, using that data to say, okay, yes, this is how I feel. This is what the data is showing. As the data is getting better, how are you feeling? And can you actually quantify that? And I think is important, both for personal use, for a patient, and for a clinician. Dave, on that note, I'm kind of, we're getting close to near the end of the time, so I don't want to go too much further, but we've talked a lot about the advent of online, telemedicine and using RPM, and you kind of mentioned that a little bit. I mean, what are some big things you kind of expect to see with Heads Up going forward in that domain and just in general?
Well, we're certainly hoping that the trend towards more remote monitoring continues, and we want to see more people with the access to the technology that Victoria just described, and to be able to do this at home and make that accessible for anyone. So it's not just a subjective report that I'm not feeling good. There's hard data there. That's something that we as individuals have never had before. And so I think making that more accessible, I think would be a positive trend. We'd like to see more push towards reimbursements for doing this type of remote monitoring. From the Heads Up side, we want to continue to integrate the best-in-class technology, because that keeps getting better. And it's a thankless job to always be integrating the latest and greatest, but that's why we exist. That's our mission, is to make what I couldn't do was I couldn't even get my blood work onto the same trend line as an individual. It was in 4 different patient portals. So like, our mission is to make that available to someone who has no tech savvy whatsoever. They should have access to that level of information if they choose that they want it. That's what we're here to do. So it's continuing to make that more accessible to more people, continuing to integrate the latest and greatest technology, continuing to make the information digestible and accessible to the layman, I think is incredibly important. Making it easier to interpret, making it easier to share with your provider, whoever that may be, or just making it easier to self-manage, self-diagnose. So I think it's just more of the same, John, continuing on the mission around making the data as accessible as possible and as easy to understand as possible. I think there's potentially more we can do as the intelligence in our software gets better, where the software might be able to find things for you that were not obvious to you just by looking at the data, obvious correlations that could be detected easier, for example. That's coming down the road, but for now, it's just making sure that everyone has access to this type of data and this type of technology, and that it's as accessible as possible.
Great.
And thank you, Victoria, for officially quantifying feeling like crap.
You're welcome.
Progress for science.
Yes.
Yeah, maybe on that note, I think maybe we give kind of final thoughts, and then we open it up to Q&A.
Questions.
Yeah. So maybe with Jim, if you want to give us kind of final thoughts on this topic.
Yeah, I mean, if Metabolic Health Summit was 14 months ago ish.
Yes, it was right before the shutdown.
Yeah, and obviously we were trying to figure things out in Q2 of last year, what companies were going to be around and what the health profile of our country and globe was going to be like. But I mean, if we look at just the last 9 months of how fast things are happening in metabolic treatments of chronic disease, and the people coming into this space. And look, we're a biomarker, and Heads Up has, puts all these together, but ultimately there's research going on all over the place. And if you could just extrapolate what's transpired in the last 9 months, there is so much momentum right now. We have a pancreatic cancer trial right now at WashU with an SGLT inhibitor. We have at least one oncology study a week coming into us globally on how we can support that with better data or more data, with the area under the curve. So, again, we're just one biomarker. So when you start to put all these together, I think that when we look back just 2 years from now, we're going to sit at Metabolic Health Summit, maybe just next summer when we're at Metabolic Health Summit, we're going to be like, holy cow, this is fast. And maybe the USDA is going to be another 5 years, another look at this. But the bottom line is, I think this translation from research to clinic is going to happen. And there's too many people seeing benefits from it, So it's so exciting to be in this field. It really is.
Yeah, no, that's a great point. I think, in terms of growth markets in the United States, healthcare is number one, basically, at this point, besides like energy. But so I do think we've kind of pushed past the barrier that was blocking us. And now with the momentum that you described, it's just, I think the next 2 years are going to be like the last 50 years in terms of information and research and technology. So maybe Angela and Victoria, if you guys want to give some final thoughts on MHI and what you see down the future.
Yeah.
Go ahead, Angela. You kick it off. We like to talk at the same time.
We do, yeah. No, I think just from my perspective, I think it's any scientist's dream, to be able to start with something in a lab and then eventually impact someone's life. And being able to be in this field at this time has really been an honor, because it's not something that I could have said I would have imagined getting to the point where it is now. And I was a tiny part of that. And this whole group has been there from the beginning, really pushing this forward, and being a part of that has just been really incredible. And so it's really exciting to see how fast things are moving now, because there's such a stark need for it, and people want it, and clinicians want to give it to their patients. And it's just amazing to be a part of it, really.
Yeah, I would agree. Especially over the last couple of years, like Jim, what you were mentioning, how we're going to look 2 years from now. I mean, just this past year has been, while it's been a challenging year, it's also been such an exciting year for where metabolic health and therapies research is going. I think the conversation has really exploded that much more, considering sort of some of the challenges we've been facing. It's, what can we do to support that momentum is really been really cool for Angela and I to continue that discussion of like, okay, how do we support the patient side? How do we support the clinician side? Because I think at the end of the day, it's become very empowering on both fronts. Where you provide these sort of tracking tools to the patient, the information, the science education to the layperson has created such change, I think, in the industry. And then you also provide the clinician with access to much more collaboration with their patient and scientific information. It's just this like explosion of, I could not be more excited for where this field is headed, and to be a part of, a platform that's really trying to drive it forward. So we're just thankful. I think this call is very, this webinar is just very symbolic of like, you've got Heads Up, we've got Biosense. All of us are working with such synergy to move this forward, and this is what it's all about for me. So yeah, couldn't be more excited at the end of the day to talk to you, Jim. Like, we'll sit down in the audience, see where we are 2 years from now. I think it's going to just be that much more incredible. So.
And so if people want to know more about you guys, what's the best way to?
So you can find our website at metabolichealthsummit.com, but we're also on all the social media platforms at Metabolic Health Summit. We do try to provide, weekly education and sort of synthesize a lot of the science that's coming out and down the pipeline. So you can find us there. But you know, May of 2022, we're going to be coming back together. I can't wait to see you guys in person.
Yes.
And hopefully everybody here on the chat, because we're going to be coming back together and actually celebrating the 101-year anniversary of the ketogenic diet being created as a metabolic therapy for epilepsy. Believe it or not, it actually has been around for a long time. So yeah, we're excited about that. And we hope to see everybody in person maybe next year.
You know, a small plug for MHS. They do the thankless job of trying to and beautifully pulling together the academic research and science, and also the technology and the companies bringing products to market there, just bringing great energy. And then also the content. It just, you guys do a fantastic job of making sure that there's something for everybody there. It's my favorite event of the year. I can't wait to be back there as soon as you guys are rolling again.
Thank you so much, Dave. That means a lot to us. We really, it's very inclusive at MHS. We tried, yeah, we really tried to be that way. And honestly, it was very scary to even explore that to start, where we were bridging these two worlds of science and essentially society. But it's been a fun process to see it unfold kind of really well. And we appreciate you guys, and it wouldn't be possible without our partners. So we couldn't be more thankful for you guys.
You guys have the clinical studies down there on these big boards, and then upstairs there's guys on BMXs like doing flips in the air.
Josh Perry performed. I know. So we tried like A to Z experience. Like, how can we really showcase metabolic therapies?
Yeah.
Yeah. So what Dave is talking about, we actually had Josh Perry, who's a pro BMX athlete, suffered from he's had 4 brain tumors, and found the ketogenic diet as a way to, you know, he said, manage his condition and get back to BMX. And so we said, well, I remember talking to him on the phone, why don't we build a ramp inside the building
at the gala dinner?
Yeah. And Angela and I talked about it. We're like, we got to get some good liability insurance. It worked out really well. And it was, you know, we really tried to provide an experience for people the hard, you know, the science, the bleeding edge to, you know, what does this look like in real life and on a ramp? So.
Yeah, no, definitely. Somebody who slept through many like medical conferences, I do appreciate that dynamic.
Yeah.
Jim, do you want to also maybe tell people how they can find out more about Biosense and the research you guys are doing?
Yeah, I mean, the company's Readout Health, so anybody can reach out to me, jim@readouthealth.com or mybiosense.com.
Awesome.
We're on all the social channels too.
Yeah. So maybe we go through some of the Q&As.
Yeah, is Nikki or TJ on? They've been monitoring the chat.
Yeah, you probably have to invite them back to be.
Let me see if I can find Nikki in here, and we'll take a few questions for those that are still with us.
We have a few more minutes if anybody wants to stick around.
Yeah.
You know, for those who are leaving, thank you for joining us, though. It's been a pleasure. It's been a great webinar. I really enjoyed speaking with everybody who's been here today.
Questions, Nikki?
I'm looking in the Q&A, and I do have one, though, that was shared earlier that I will ask you in just one second. Dr. Lemansky, I think this was a question for you, really for anybody. They asked, do you have a list of best practice metabolic tests by tier, meaning like tests that you must get or good to get, or just sort of the gold standard? That was a question that we had.
Yeah, I mean, I can answer, you know, in general, I think with anything that you're going to do in terms of changing diet, medication, lifestyle changes, I think it's good to have a good baseline before you do anything, before you make changes. Kind of like what we talked about with the COVID experience, having a baseline of information. So depending, and it varies, I would say, somewhat depending on the individual, where they're at metabolically, but, you know, basic things to begin with. So CBC, a CMP, NMR lipid profile, you know, fasting insulin, a high sensitivity CRP to begin with. Depending on cardiac issues, something like a calcium score to make sure there's no cardiac issues. And then at that point, it really depends on kind of directional, what their goals are, what their metabolic health is. Depending on those things, then it'll kind of change what I'll order. Other things like thyroid function, cortisol levels, hormonal levels, depending on men and women, things like testosterone, estrogen, progesterone to begin with. Kind of thinking off the top of my head, but those would be the ones I would say are a good baseline for me. I don't know if anybody else in the panel has other ideas. Then I'm correct.
Nailed it.
Nailed it. Perfect. Okay, next one. I'm just going to rapid fire you guys. What lipid measurements are the most helpful?
Yeah, again, I mean, I think NMR lipid profile. I think a basic cholesterol test is pretty much useless except for the triglyceride. That can give you some information. Actually, triglycerides, fasting triglycerides can give you a lot of information. But otherwise, I would say NMR lipid profile. And I'm glad somebody asked this question because the cholesterol saturated fat issue with cardiac disease is probably the bane of every clinician's existence, because that specific issue has dramatically changed our nutritional paradigm and everything that we do as clinicians. So there's a lot of research specifically in that area, which, you know, is actually changing the needle. You know, it's changing what some of the guidelines are recommending. Not perfectly yet, but it's definitely pushing the needle, and it's allowing us as clinicians to actually say, look, we're following the guidelines. You know, the saturated fat is not necessarily the enemy, although that's kind of changing with in the UK specifically, but in the US, hopefully we're making progress.
I'm not
Thanks,
a clinician. I'm just going to throw that out there, but just through personal experience with cardiac markers. John, what do you think about ApoB, Lp(a), some of those maybe more atherogenic?
Yeah, absolutely. And then, you know, particle size and particle numbers, you know, and that's all part of the NMR lipid profile. So that gives you a much better understanding of the type of cholesterol that or not even the type of cholesterol, but the type of particle that's carrying the cholesterol, which I think is important. You know, I think Dave Feldman is probably, in my opinion, the best non-physician person on cholesterol. So not to plug him, but I think he's a wealth of information. And he uses a ton of data to support what he's doing in his research, which is another point, you know, in terms of all the research that's coming out. Looking at, you know, cholesterol is not the culprit. It's, you know, what's driving the actual inflammation. So tying back to what kind of Angela talked about earlier is that, you know, metabolic syndrome or metabolic disease can manifest itself in different ways, from, you know, obviously diabetes, hypertension, metabolic syndrome, but then things like cancer, autoimmune disorders, cardiac disease, because it's that inflammation, that fasting insulin that's really causing the issue. And then obviously it manifests in different ways. So absolutely, I think those are key metrics to look at when talking about, you know, heart disease risk, stroke risk, things like that.
Yeah, it's been interesting. I just, with the COVID experience, that actually has mimicked certain sort of symptoms of heart disease. I've gone through a slew of cardiovascular testing. So it's really been fascinating. It's really fascinating, especially when you're on a low carb ketogenic diet. It opens up the doors to interesting conversation.
Absolutely. So. Dave, you might know this. Who's the cardiologist in Houston? He talks a lot about cholesterol and specifically LDL's function as an acute phase reactant, in terms of it's a huge component of your immune system. So you can see, you know, dramatic deviations in cholesterol numbers based on infection. So that's probably partially why you're seeing those things. I forget his name, but he's a
Dr. Ali, or?
Yeah, Dr. Ali.
Yep.
Yeah, he's a great wealth of information. So
infection affecting the lipid panel numbers.
Absolutely, big time. Yeah,
crazy.
Yeah, I've always been a sort of wacky cholesterol kind of person, but it was interesting because I had to go through another round of it. So I always routinely have that conversation. So it's interesting. That's why we always try to include cardiologists in the conversation at MHS, because it's such a just unmarked sort of territory that we need so much more research on. I think, you know, what those cardiovascular, you know, markers mean in the context of a specific nutritional approach is, you know, many answers to find out. So
absolutely. Nikki, anything else?
Guys? Yeah, we have 4 more. I don't know how much more time you'd like, but I can.
We're at now over an hour. Why don't we take a couple?
Sure.
We'll see how it
Okay.
goes. See how it goes.
Absolutely. So question for everyone, if there's time, do you think that arming the general public with biosensors and tools for metabolic health tracking could naturally lead to a shift in attitudes that challenge the prevailing medical paradigm?
I think that's already happening. just based on the number of people that are using CGMs and figuring this stuff out on their own. I hope that continues. And the more people that can just simply look at their wrist after they've eaten something and see what happens to their blood sugar, that's going to change the guidance and the requirements, because people are just going to demand things that they know are going to work for their body. So I think that train has already left the station. I'm just hoping that the technology and the sensors become accessible to more people, and it will come from the bottom up. That's my 2 cents on the matter.
Yeah, I agree with you. I feel like, the ketogenic diet has sort of gained in popularity and become this sort of mainstream sort of thing, primarily because it's the only sort of nutritional approach that you can actually track and see in blood and breath that I think is really exciting for people. And just in some of the research that I was involved in with cancer patients, that is one of the most empowering things ever in terms of when it comes to compliance and sticking to a diet. If you can see how it's affecting you using a variety of markers, oh my goodness, you become this whole new level of motivated. So yeah, I think it's only going to continue to expand. And I think that's one of the best ways maybe to get people to stay on track and follow through on things if they can see actual hard data.
Meal level granularity is really is critical when you're talking about behavior modification using cognitive behavioral therapy. I mean, we can't just look at stuff once a day and assume our body's the same, or assume that banana is the same for David as it is for me. So the more granular you get, and the more frequent you get, that's the critical component to arm both the clinic and the patient and or consumer, which is becoming the same, in this new era of an in-home clinic.
Indeed.
Yeah, I got to jump off there. I got another meeting, but thank you so much for having me.
Thank you, Jim.
So much, Jim.
Thanks so much, Jim.
Hi, Jim.
All right, we'll do the last one then. Are the metabolic therapies being taught in medical schools, legitimate therapies? Since several of you have mentioned that patients were researching this on their own and then having to find a clinician willing to incorporate it into their treatment.
I'm too old to answer that question. So I don't...
I'll say we are definitely seeing an improvement in terms of medical education encompassing these kind of aspects. So we work out of a medical school here at University of South Florida, and really there's been a huge interest, and a lot of it's being led by the students themselves. So student interest groups that have a significant interest in nutrition and lifestyle type medicine, and they are inviting us to come speak to them regularly about our research in this field. And so I know from a student perspective, there's a huge interest. And I do think that they're changing. I still think there's not enough nutrition education. My husband's a physician. I think he had a 1 3-hour lecture in medical school about nutrition, and nutrition should really be, a pillar of medical education. So it's complicated, but I do think things are changing.
Awesome. And then one last one following off of that. Daniel says, I'm a primary care provider who follows this metabolic health science. If I want to work with patients on this, should I start my own practice, or are there any employers that you would recommend?
I mean, I can speak to it. I would say start your own practice, because then you have somewhat of the autonomy to basically create your own protocols. And now you have the science to back up what you're saying. The guidelines are changing in your favor. And then you have the data points to actually show progression. So, we haven't really talked about this, but in Heads Up, we have a food journal where basically what Jim was talking about was, for each meal, you can actually take a picture like on Instagram and show it in our Heads Up dashboard. And you can show that to the clinician and say, okay, I ate a banana. Well, bananas used to be like, miniature. Now they're like on steroids. And so a picture really illustrates a thousand words. So taking all that information together, I think right now you have the ability to really make a significant difference in your own clinical practice. So I would personally say, I'm kind of biased, but I would say start your own.
Awesome. Thanks very much. That's what we've got.
Okay. Dave, you want to wrap it up?
I'll just thank you, everyone. This was an absolutely wonderful discussion. Thank you for your time. Thank you for everyone who
you.
joined. Always a
It's a lot of
pleasure,
fun.
Victoria. And
Looking
Jim's
forward to
not
see
here,
you
but
guys in the new year.
Yeah, we'll be seeing you in Santa Barbara, right?
yes.
Yes, absolutely.
When's the
Perfect.
event?
May 5th through May 8th, 2022.
Can't
It's gonna be amazing. I know, we're very excited. It'll be good to finally get back together. And in the meantime, we'll see all of you in cyberspace. So
Sounds great. Thank you, everyone. Thanks,
you, Tim.
Nikki.
Thanks,
guys.
everyone. Bye-bye.
All right.
Bye.